Dr. Bacon, I just want to start with the news that we're hearing this week that analysts are saying we could reach herd immunity as early as this summer. Now, that was a term we heard thrown around a lot, especially at the beginning of the pandemic, sort of as a goal. So if you can explain to us exactly what that is and how will it help in our fight against COVID-19?
Herd immunity is simply the idea that enough people in the general population have either natural immunity from an infectious disease, from having had it and recovered, or have been vaccinated against it. What we are striving for with the mass vaccination campaign is to get enough people vaccinated so that we have a large part of the general population that is immune to COVID-19. That will help because it will slow down the spread of disease. Generally, if you're immune from an infectious disease, you won't be able to get it, and then you won't be able to spread it. And so that's the hope that we will have by late spring or early summer. It varies from disease to disease. With COVID, we don't have an exact estimate. Most people feel that 70% is a good estimate, but it may be as high as 80%. It may be as low as 60%. And the other thing to remember is we don't need herd immunity to completely slow the spread of the disease. As more and more people get vaccinated, we get closer to that threshold and more people will be immune, and that will slow the spread of the disease as well.
Gotcha. Well, I know a big step in this effort is set to happen very soon, I think as early as this week, when teachers start getting vaccinated with the Johnson & Johnson vaccine here in Pennsylvania. So for any teachers watching this right now, what exactly do they need to know? Do they have to reach out to set up this appointment, or will they be contacted?
According to the state, this is going to be working through the school districts and educational institutions. So the state is setting up vaccination clinics. According to their guidance, they are reaching out to school districts and to other educational institutions to identify these individuals and then to make appointments so that they can get vaccinated starting this week.
All right. And hey, we want to get to some viewer questions as always, too. We got a first question from Mrs. Wanigat, who wrote in and wanted to know, if you get the Johnson & Johnson vaccine when it's available to you, should you also consider getting the Pfizer or Moderna vaccines in the future when they may also be available as a way to boost your immunity?
Right now, there is no indication for getting the Pfizer or Moderna vaccines if you've received the Johnson & Johnson vaccine. You should have equivalent immunity after about 4 weeks from getting the Johnson & Johnson vaccine. It's possible in the future we will all need booster shots, and that may come from different manufacturers, but we're not there yet.
Okay, thank you for clearing that up. And a final question today comes from Bernadette, who wrote in with a situation a lot of people may be finding themselves in right now. Bernadette is a grandparent. She's fully vaccinated. Her children are fully vaccinated, but her grandchildren are not. And she just wants to make sure that it's safe before they get together.
So I'm assuming the grandchildren are pediatric age individuals. So they're below the age of 18. Generally, they should be very unlikely to get severe COVID-19 illness. So my personal recommendation is that in small groups and still wearing masks, it is safe for vaccinated individuals like this viewer who are grandparents to visit their children and grandchildren, but they should do it safely. And if they can do it outside, that would be even a better option.
It's good to have those face-to-face meetings again. All right, Dr. Venkat, thank you so much as always. If you at home have any questions that you'd like us to take to the doctor, we're happy to do it. You can message me through the WTAE Facebook page or through my Facebook page.